Hello everyone. Today, I'd like to share a case study about menstrual pain. This involves a young woman in her 20s who had been suffering from dysmenorrhea for 7 years. When she came to us, her complexion was pale. During her menstrual period, she experienced abdominal pain, vomiting, and was unable to eat. She felt cold throughout her body, and her hands and feet were icy. Her menstrual cycle was relatively regular, with dark-colored blood and clots. Outside of her menstrual periods, her appetite was decent, and she had a preference for cold drinks. She suffered from poor sleep, frequent dreams, easy awakening, and difficulty falling back asleep once awakened. She had no issues with urination or bowel movements. Her tongue was dark with a white coating, and her pulse was deep and thin. Upon the patient's arrival, we first conducted an inspection. The girl's pale complexion and lack of healthy color indicated a deficiency, specifically a lack of vital energy in blood. She came to us because of her dysmenorrhea. Pain-related issues are often linked to two main causes. One, as many know, is the principle: if there is no free flow, there is pain, meaning that pain can occur when there is a blockage preventing the smooth flow of energy in blood. The other is, if there is no nourishment, there is pain, indicating that pain can occur when energy and blood fail to nourish a particular area. First, we checked for signs of blockage. The girl's dark menstrual blood with clots and her dark tongue were typical manifestations of blood stasis. Then we examined if there were signs of blood deficiency failing to nourish the body. Her pale complexion indicated blood deficiency failing to nourish her face. The overall coldness and cold limbs suggested blood deficiency failing to nourish the skin and limbs. Poor sleep, frequent dreaming, easy awakening, and difficulty falling back asleep were signs of blood deficiency and a disturbed spirit, as the heart governs the blood and is responsible for mental activities. A deep and thin pulse also indicated blood deficiency. Therefore, this patient exhibited both blood stasis and blood deficiency. Additionally, there was the issue of vomiting. This was actually caused by cold in the liver and stomach meridians of the Julian channel, leading to the upward disturbance of turbidine. This is based on Zhang Zhongjing's system of diagnosis through the 6 meridians in the Treatise on Febrile Diseases. This system has a comprehensive theoretical basis and is quite fascinating. Of course, in practice, Chinese medicine often employs a combination of diagnostic methods, but we won't delve into that here. Returning to our patient, she had blood stasis, blood deficiency, and the aforementioned liver and stomach cold disturbance. On further inquiry, our patient frequently consumed cold drinks, even during winter and her menstrual periods. Blood needs warmth to flow smoothly and coagulates in cold conditions. Thus, long-term consumption of cold drinks can lead to blood stasis. Moreover, the spleen, which prefers warmth and dislikes cold, is responsible for blood production. Prolonged intake of cold drinks can weaken the spleen yang, leading to insufficient blood production and the problems of blood deficiency. This also contributed to the cold condition in her liver and stomach. Her case of dysmenorrhea is quite representative. Many young women consume cold drinks during their menstrual periods or wear very light clothing in winter. Such habits, which do not properly protect against the cold, can easily lead to dysmenorrhea. Of course, individual constitutions and specific circumstances vary, and not everyone who eats cold foods or dresses lightly will necessarily suffer from dysmenorrhea. There are also other causes of dysmenorrhea unrelated to cold food consumption. However, frequently eating cold foods during menstruation can indeed trigger dysmenorrhea, so caution is advised. Her treatment involved warming the middle, strengthening the spleen, nourishing the blood, and promoting blood circulation. We used Lishong pill combined with Taohong Siwu decoction and added motherwort. Additionally, acupuncture was performed at points including Zhongji, Qihai, Guanyuan, Zusanli, Sanyinjiao, Shuahai, and Taichung. Her condition was not complicated, but treating menstrual disorders usually takes time. After 3 months, there was improvement, followed by further adjustments over the next half year, leading to a near-complete recovery. It's true what they say, illness comes like a landslide but recedes like drawing silk. That's all for today's share. Goodbye.